Hi there, it's Jonathan with another episode of Homeopathy Simplified. In this episode, number 9, I'm going to talk about the mistakes we all make in homeopathy as homeopaths and as new people using homeopathy. I'm going to primarily focus on one big area of mistake, and that's to do with the repetition of a remedy. So, just a little bit more about myself. I am a practicing homeopath, and I was first introduced to homeopathy through my father, John de Monte, who in the 60s and 70s was really one of the key figures in homeopathy's resurgence in Europe at that time. And I was really fortunate to study through his students, and I think it's really wonderful to have that familial connection. In my career, I also became a Bowen therapist, and I developed a practice focusing on chronic pain and disease. And now I've come full circle, and I want to share my knowledge. So if you're enjoying this, you're the lucky recipient, perhaps. And I've actually created a course called Homeopathy Simplified, and you'll see some reference to that. Here's a picture of my father, John Andre de Monte, and it's a bit blurry. I don't know why. Perhaps it'll come into focus slowly. I know why. It's connected to the web. There is the focused picture. And actually, I look quite like him, but with hair. So let's go on. So this is an episode about the mistakes we make. And in this lecture, I want to focus, as I said, on the re-prescribing of a remedy. So how and when to take a remedy after you've observed the first dose. So it is misunderstood, and it is a mistake to do it wrong. And looking up the word mistake, we see that it means a wrong judgment, a misunderstanding, a wrong action or statement proceeding from faulty judgment, and then based upon inadequate knowledge or inattention. These are very meaningful meanings to these words. So the most common mistake we make is defining what's wrong with the person as a disease name and then selecting a remedy based on that disease name. In homeopathy, we want to prescribe according to the symptoms, and that may or may not include the pathology that you can observe. So, for example, a 6-year-old has a cough, and the parents Google homeopathy for coughs, and they end up with a list of remedies without much clarity on which one of those might be best. And it's often the way with homeopathy. The way it's used is extremely unreliable. So, not to misunderstand the importance of the pathology, the remedy we choose must treat that pathology, but it is really low on the list of the factors we use in choosing a remedy. I would add to this and say that, if you've got a list of 5 remedies on Google, let's say, you'd get 1 out of 5. That's 20% reliability. It's not good enough. If you're using a remedy to treat a chronic condition or even an acute condition, you need to be much, much more reliable than that. And research is showing that homeopaths can be in efficiency 70-75% reliable in their prescribing. That's amazing. That's not to be sneezed at. That is a high reliability, and that's what we aim to do as a homeopath, is to have a 70% effectiveness in our prescriptions. So, high ideals, but not really. That's how homeopathy should be. If you do it right, and if you follow basic principles, that's what will happen. So, a symptom in homeopathy is defined as more than the pathology. It includes unique characteristics of the symptoms of that illness, which is the pathology. So we observe those nuanced characteristics of the illness. Now, the second most important mistake we make in homeopathy, and I'm going to spend a bit more time on this, is when we give the remedy according to the label instructions. So I know that in Canada, for example, there's a company, in fact, all the homeopathic companies, but the main one being Boiron. It's a French company. And Boiron has instructions on their bottles of granules of the remedy. And they say to take 5 globules 3 times a day. That is completely absurd. In fact, most homeopaths that I know would be satisfied with just giving 1 globule and waiting and seeing to then learn how to re-prescribe based upon the reaction that they have. So it's not a drug when we give a homeopathic remedy. It is a stimulus to the body to revisit its manner of coping or managing the problem it's trying to deal with. So it's like a push, a sail that that needs to catch the wind in order to move in the right direction. The remedy is the mechanism that puts the sail in the right alignment. So remembering that it's not a drug like a synthetic or chemical makeup that we are using, like an aspirin or diglyceride or anything like that. It is, again, that stimulus to the body's own regulating systems, stimulating those systems to behave better. So I always use this example. You may have heard it already in this podcast, but I think it's important because we all know it. So if you drank too much coffee and you had really 5, 6 cups, some people, maybe have more than that, and feel this nervous system effect. They're revved, they're sleepless, they're stressed, they're highly sensitive to all external stimuli. But imagine you were like that without having drank any coffee at all. In homeopathy, we might potentially use coffee homeopathically, in other words, made in dilution, and give it to a person, not because they've drunken a lot of coffee, but because their nervous system is so heightened, it's almost like they've had the same effect as if drinking a lot of coffee. So if we give that, it's going to wake up their body and stimulate it to deal better with the symptoms that we're provoking. They are the same symptoms. We're giving a dose of the same problem. That's how homeopathy works. And so therefore, if you repeat the remedy too soon and too often, you may actually make the patient worse because you don't need to always take a medicine. If you took an ibuprofen or aspirin for a headache and then the headache got better, you wouldn't keep taking it every 3 times a day, 5 pills, like they instruct on the homeopathic bottle. You would take it if the headache was better, and if the symptoms return, you might take another one. Same for a homeopathic remedy. We always want to know what is the result of the prescription, what is the result of the remedy after we've taken it. And this is going to be a discussion now about how to manage both the chronic diseases we treat and the acute diseases we treat. And bear in mind, a chronic disease is something that's persisted for more than 3 weeks. So it may well be that you've had a cough for 4 weeks. That's a chronic cough. So anyway, if we looked at this chart, you'd see at the very top, the first remedy dose. We would wait. Now, how long we wait depends. In chronic conditions, we might wait days. In acute condition, that wait might be just hours. And then we would observe what are the effects of the remedy. Did the symptoms improve? Did the symptoms worsen? Was there any change at all? I'm going to zoom in on this left-hand side, which is the chronic disease, and so you can read it better. So these are three essential options. If the symptoms improved, the best thing to do is wait, and we wait until either the symptoms worsen, in which case we could repeat. However, if we wait and there are new symptoms, we would actually retake the case and re-prescribe. It may be the same remedy that is prescribed, but it may be another remedy because we've got new symptoms. If, in the instance where symptoms worsen, we'd actually wait. And there are more steps to follow after this wait, but I don't go into it here because it gets complicated. Now, if the chronic condition after the remedy, there's no change, we simply retake the case. We don't keep repeating a remedy over and over just because we feel it should work. And so looking at the acute conditions where we wait just hours to observe if the remedy is working, if the symptoms improve again, we wait. If after waiting and the symptoms worsen, repeat. If the symptoms change and there are new symptoms, retake the case. So that's very obvious, just like the example of taking an aspirin for a headache. However, if we give a homeopathic remedy and the symptoms worsen, we wait because sometimes, we are giving something that is very similar to the problem that a patient is suffering. So sometimes we super add that problem and there's a small aggravation. How often, if there's an aggravation, we'll often find there's an improvement afterwards. So if there's improvement, we keep waiting. Now, if we have waited and the symptoms still remain worsened, we would retake the case. Then in acute conditions, if there's no change at all, we might repeat, just because it might be a low dose of remedy. You might be treating your child's cough and the remedy chosen seemed like it should have an effect. The person prescribing it or yourself felt very confident in it. You may repeat maybe 2-3 hours later and just test again. If after that second repeat there's no change still, we retake the case. So that can happen. So you can see here that there is no way that a credible homeopath would prescribe a remedy frequently. I remember the most bizarre case I treated, as a Bowen therapist. I had a lot of people with muscle spasms and that sort of thing coming to the clinic. Well, a colleague had referred another practitioner of another modality colleague had referred someone for a muscle spasm. And in taking the case, what medications are you taking? Turned out that patient was taking, on the advice of that other colleague who was not a homeopath, a remedy and taking it 3 times a day according to the bottle. And in fact had bought 10 bottles of this remedy. And in one of the symptoms that remedy is known for is a particular spasm. So in my estimation, that patient was actually experiencing the side effect of that homeopathic remedy. So it happens. It's not obvious to anyone. If you read the label of a professional brand of medicine and it says take a remedy 3 times a day, well, who are you to argue? And yet it's just an absolute travesty that is the instructions on the label. So that's my webinar for today and podcast for today. I hope you liked it. And if you're interested in more, get on the homeopathysimplified.com mailing list, and you'll get notified of other webinars and special events. And always, if you're interested in learning homeopathy, the Homeopathy Simplified course is accepting students for the wait list till the next launch. So thanks so much and talk to you soon. Bye-bye.